Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to continue our talk on sport-specific athletic injuries. We're going to talk to you about different treatment protocols for our cross-country runners. You're not going to want to miss this one, so stay tuned. Okay, Dr. Mike, last week we talked about injuries specific for football players. Now we're midway through cross-country season, but we got indoor track and we got outdoor track coming out. How is Maragal Medical positioned to treat the runner?
So we look at it from that whole aspects of the back essentially down.
Yeah.
We think about runners, there's a lot of core work that now runners are realizing, coaches are realizing, that our athletes who are runners really need to have a lot of strength in their muscles of the core. So there's a little bit of strain, a person has a little scoliosis, people who have a little asymmetric, pelvis. If they're not really strong in their core muscles, they may develop these asymmetries and weaknesses that lead to strain injuries at the ankle, the knee. So we're focused to be able to look at that from the back down and really identify that they're not coming in just for an ankle sprain.
Yeah. We're
really trying to look at them as more, why are their mechanics not working? We have ability to look at it from the chiropractic side, we have the physical therapy, we have a balanced program that has a special ankle program. So we can really look at those differences between left and right legs as well as address their injury directly.
Yeah, so you'll see those acute injuries, like you said, like the ankle sprain, like once in a while, but usually it's always that repetitive strain. And I gotta tell you, I was shocked, as we were treating the kids, from Lexington High School, a couple of runners that had come in, freshmen, sophomores, their flexibility was awful, and this is from a cross-country perspective. So those athletes should definitely be on the more flexible side, and if you could just really focus on, a couple of common muscle groups like the hamstrings, the IT band, the gluteals, and the hip flexors. Those four muscles, and I like to demonstrate those are muscles that the kids and I try to do on a regular night. We get down into the basement and we do our stretches. You can really help yourself out a lot by preventing injury if you just keep those muscles nice and loose, right?
Without question, and the concept to also remember from our high school athletes as well, the concept is they're changing, they're still growing, so they are going to be inherently tighter.
Right.
The muscles will be more tight, especially if you've had a growth spurt over the last year or two. So we have to constantly be on top of them. They may hear from the coaches stretch, but when they leave it to the kids only, there's not a lot of focus to actually do what you're doing and getting those muscles that really need to be stretched continually because they are still growing. But then there's the concept that then the mechanics. Do they have a little knock knee? There is a flat foot. Maybe we need to get a custom orthotic so they can actually run with that better mechanical position, because that's going to even get worse when they're tight. Just think of how tight the Achilles can be when they've grown, and then you've got a flat foot on top of that. Those things are what we're going to look at. So a person comes in with a hip flexor strain, we're not focusing on the hip flexor only. We're looking at it all the way down to their ankle, including their hamstrings and the Achilles and the calf muscles. That's how we're looking at it as an injury from a runner.
Yeah, and I find too, from a chiropractic perspective, so a little twist at Maragal Medical, including chiropractic care, a lot of the lower extremity muscles being really tight. Oftentimes, if you just stretch those to death, you're not going to make as much progress as you would hope, because a lot of times the joints in the pelvis and the lower back are locked up. So adding that chiropractic adjustment, which is a nice gentle procedure, it's a good stretch into the lower back, can really go a long ways in helping to keep those muscles nice and loose as well, or get a better response from the stretching. And like what you're saying, footwear, we're in a day and age where, shoe technology is like at an all-time high. You go to most running stores, they do treadmill analysis too, but if you're a runner or a parent of a runner, and if you look at your son or daughter's shoes, and if you see some abnormal wear pattern at the bottom of the shoes, you're definitely going to want to bring them into the office, because we got this great technology where we can laser measure the arches in the feet and get a real specific look at what those discrepancies are. And we use a great orthotic lab in Virginia that custom makes the orthotics. That can help a long way.
Without question, again, so we think about all those factors that you just mentioned in relation to the customizing the aspects of that runner's problem. And so when we look at it, and I use your chiropractic concept, that's going to help mobilize their joints. So the restrictions that come into play when their joints and the ligaments aren't moving as nicely are as important as the muscles that are tight. So that's why it's so important. So when I look at them, I would say, you know, this one's falling outside the normal, this one might need a little x-ray, but many times you don't need diagnostic studies, you just need a good clinical exam and looking at them from both right and left side, all the way down, and then try to encourage them to get their proper treatment, and that's what we can do here at Maragal Medical.
Yeah, and I think that's a huge advantage, is being able to go to a clinic where there is an expert. Dr. Marciello is board certified physiatrist, expert and board certified in physical medicine and rehabilitation. So he's going to look at your injured athlete from top to bottom. He's got the clinical expertise to be able to make an accurate diagnosis, come up with a very specific treatment plan for that sports-related injury, and get that athlete turned around safely as quick as possible. If you're interested in learning more about the treatment options that we have at Maragal Medical, you're just going to want to check us out on the web at maragalmedical.com. And folks, we take most insurances. Well, that's it for today. I hope you learned something. Have a great day, everyone.
Take care.